There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
Salt is NaCl. Sodium plus chloride. These are the main elements along with potassium and extracellular fluid i.e. blood in the body. Na is excreted and reabsorbed in nephrons of the kidney. In nephrons, wherever sodium is absorbed or excreted, water goes along with it to balance the Na of ions both sides. Usually more Na is reabsorbed and so water is also reabsorbed. Finally we will get hypertonic urine with less water. In healthy person's kidney will take care of the balance of sodium and water. But in diseases like hypertension or cardiac or kidney disease, if you eat more salt Na, it is absorbed more and so water is also absorbed more, which leads to further hypertension and swelling of face and legs. So it increases BP. So in diseased persons salt intake is directly proportional to BP. A heavy salt diet disrupts the natural sodium balance in the body. This causes fluid retention, which increases the pressure exerted by the blood against blood vessel walls, high blood pressure. It has been estimated that a reduction in salt intake from 10 grams per day to 6 grams will reduce blood pressure and could lead to a 16% reduction in deaths from strokes and a 12% reduction in deaths from coronary heart disease. Reducing salt is one of the quickest ways to reduce your blood pressure, particularly if you already have high blood pressure. People with or considered at risk of high blood pressure should take extra care to ensure that they keep their salt intake below the recommended maximum of 6 grams. This can be achieved by simple changes, such as consuming less processed foods and checking product labels before purchase. If there is more salt in cardiovascular system as compared to cells will release more fluid towards blood, resulting in more urine and lowering of the BP. If there is more salt in cells than in cardiovascular system, then cells will draw more fluid from blood, resulting in swelling in cells and high BP. I have seen BP shooting up after salt consumption in some patients who are consuming more salt on regular basis. People who are on low sodium diets show lowering of BP when starting salt intake for first 2 to 3 days. Read my blog for more info on health matters. Healthy India now. In